Hi and welcome to the second part of EPA series. Today we're going to talk about tasks and responsibilities. If you remember from our previous video, tasks and responsibilities, this is one of the parts of the standard, and actually when you go for your EPA, this is what you are tested on, so your knowledge on the standard elements. Within that section, you need to be confident talking about those 6 areas that you can see on the screen now. So those are the 6 criteria. You will have covered them throughout your qualification more than once, demonstrating knowledge for each of them. What I would suggest, read through the criteria that relate to your professional discussion exam, so you become familiarized with the wordings that you can hear during the exam, because some of the learners can be put off by the length of the questions, the lots of the different components. So for example, the assessor could change one of those criteria into a question. So it could be asked, could you tell me about statutory framework, standards, guidance, and codes of practice which underpin practice in relation to the safe delivery of service? So it's already quite a long question packed with lots of very specific wording. So you need to be familiar with that and what it means. So what we're going to do in today's video, we're going to go through each of those, and I'll briefly talk you through how you could answer and what to include. In your EPA pack, you will have some guidance in terms of how to present your answers and what is expected from you in terms of each of the criteria. So you can see here for K1, so statutory framework, standards, guidance, and codes of practice which underpin practice in relation to safe delivery of service, you've got pass and distinction. So the main difference between pass and distinction on all of the criteria is how you present the information. So you can actually see here, you've got explain, and then on distinction, we've got critically evaluate. So if you're going to be explaining, describing different frameworks, different standards that you follow in your day-to-day practice, then that's going to give you a pass. But if you move towards that critical evaluation, that's what's going to give you distinction. So there's actually a simple way of achieving that. So for each topic that you discuss, the knowledge element, think about the example of where you apply that knowledge, and how you do it. Think about some challenges within that area, and this is actually what's going to give you distinction. What you need to remember is that the assessor wants to hear about the examples from your practice, so they want to see how you put that knowledge into practice. So that's very important. So here we've got for that criteria, explain how they use and prioritize statutory standards, guidance, and codes of practice which underpin practice in relation to the safe delivery of service. On the distinction, you've got critically evaluate. So what we need to focus here, so we've got here a couple of elements. We've got statutory, standards, we've got guidance, and we've got codes of practice. So you need to know what they are. So you have to include, name the specific acts, codes of practice, maybe different frameworks that you follow that's specific to your service. So something to do, maybe, for example, with dementia. For the distinction, to take it to that next level, judge which framework is most effective in your organization. So which one is most relevant to you, to what you do, to what service you deliver. Talk about some strengths and limitations. And here, if you can't think of the limitations, think about the challenges within that area. And then, like I said, support that with the examples. So I'm going to show you a couple of a few of the frameworks that you need to remember. So if we look at the statutory framework, so we can look at that as the legislation, because the legislation is the one that gives you guidance in what you need to be doing in your day-to-day practice and to what levels. That sets the standard. It's a benchmarking. I would always start with this one, because thinking about level 5 services that you work in, this is going to be a very important one. So it's a health and safety Health and Social Care Act 2008. This is the act that introduced CQC fundamental standards. So that's another one. So you're actually covering that one within it. And then Regulations 2014. So when you look at the CQC fundamental standards, it's usually like about 13 that are most relevant to you. And when you look at the regulation, it's almost like a repeating itself. So regulations is more a kind of like enforcement, more of kind of linked to the law, while the standards are more of like about the benchmarking. So you need to be familiar with those. So this is actually what guides the CQC inspection process. So all your systems in terms of the compliance monitoring going to relate to that legislation. So this is basically how you deliver safe and high quality care. So, read a little bit more about that legislation. Think about what sort of things that you do specific to your role that that legislation guides that process. The CARA 2014, another very important legislation for you. So here, what you've got here outlined kind of key elements of what it covers. So we've got the well-being element. Just remember, for you, the well-being also covers the staff well-being, but in here for this part of the session, we're focusing on the well-being of the individual. So talks about the well-being, reinforces importance of person-centered care. So everything that is or how the individuals are supported, you need to be able to evidence it is done in a person-centered way. And safeguarding is again heavily covered within that legislation, and I would here highlight the partnership working element of it. Have a look also at the safeguarding principles. I've got 6 safeguarding principles that are linked to this CARA 2014. I'm going to cover that in a different video, but just make a note of that, because it's very important that you are familiar with that. So again, think about where that legislation impacts your role. I would start probably with the care planning, the risk assessment that you write in a person-centered way, maybe then the training for your staff, all of that. And then other legislation that you're going to be using. This is just some of the examples, because we know there's so much more to adult care. You got Health and Safety at Work Act 1974. So again, that's about your duty of care towards the staff, to keep them safe, and towards the individual. So all the systems you put in place, like policies and procedures, risk assessment, different protocols, the training for staff, recognizing the equipment that they need, that's all going to be kind of that framework, that health and safety element. Again, if you provide support with moving and handling, you've got this legislation, and there are other that are also kind of more specific to if you're supporting individuals with mobility issues, and there are hoists used, or there are maybe lifts in your building as well. This one is a generic legislation that would also cover moving and handling of objects and people. So then if you move people like in a specific way, then the other legislation will come to support. Then you've got COSH as well, so anything to do with the hazardous substances. I'm not going to be explaining that, it's kind of highlighting this is probably another framework we're going to follow. Think about the infection control in respect of that. RIDO 2014 sorry, and this is the one that guides your incident reporting. So all the incident accidents, the systems that you need to have in place to allow for recording, monitoring and actioning that, and also reporting of those specific incidents with the specific injuries of death of the individuals. You're going to have PPE regulations as well, fire regulations, food and hygiene regulations. So again, depending on the nature of your work, you can include those other frameworks. There's a lot to cover within that. When we look here a little bit more, I've got Mental Capacity Act 2005, so anything to do with the capacity assessment or supporting individuals to make decisions, to make choices. Equality Act 2010, fair, inclusive and non-discriminatory care. Again, remember this is a big part of the CQC compliance as well. Anything to do with the information handling, give your Data Protection Act, GDPR, also Digital Data Act now as well in terms of your digital record. You've got the safeguarding legislation and local procedures. So for your safeguarding vulnerable groups Act 2006 is going to be very important. In terms of those codes of practice, so we've already mentioned one, so CQC fundamental standards. So read about them so you at least know a few of them. When you look at them, if you feel like at the moment you can't recall any, when you look at them you're going to see, oh, actually, I am familiar with those, so just remind yourself. Another code of practice that you need to be promoting, big for this qualification, is your 6 C's. So those are the 6 behaviors that you need to demonstrate that you deliver on through the different examples you're going to be sharing throughout your discussion. So then you're going to have the CARE certificate as well, because that's the, the basic requirement of knowledge and competencies of your staff. And then you've got skills for care code of conduct. So those four are the codes of practice. Of course, if you work in the mental health, then you're going to have a mental health code of practice as well, linked to the Mental Health Act 2007. So anything specific like that, you could also mention there. So that's in terms of the statutory framework codes of practice. If you're going to cover that in detail, then some of the questions or the criteria that come later, maybe, or the assessor may decide that, oh, actually, you've covered that, you are competent in that area. Let's move on to K2. So that's about compliance, health and safety and risk management. So here we've got systems and processes needed to ensure compliance with regulations and organizational policies and procedures, including health and safety risk management. So what you need to achieve here, so you have to, for PAS, explain how you use and prioritize statutory standards, guidance and codes of practice which underpin practice in relation to health and safety and risk management. And then on the distinction side, so again, critical evaluation. So again, think that are relevant to your role, judge which systems work best in your organization, again, strengths and limitations, maybe propose another approach that could work better, and let's support that with an example. So here, again, if you have covered that K1 well, then you probably have covered parts of it as well, because the other one was more kind of broad overview of your compliance, thinking more about the CQC. And here we've got with the focus on health, safety, and risk management. So again, just to highlight those. So when we mention Health and Safety at Work Act, again, that would directly link to this area. So what you need to focus here, so your systems and procedures that keep services safe, effective and compliant. So what sort of systems have you got in place that help you to monitor the compliance, ensure that you're meeting the requirements, that you're minimizing the risk, that you support safe, high quality care. So here you can cover things like policies and procedures. So remember, policies and procedures, they translate law into practice. So this is how you tell, for example, in legal care, the CQC, your staff, other people, how you're going to be meeting that law requirements. It's kind of like a little bit of a translation. Think about it like that. So you're going to have lots and lots of different policies and procedures, and they're going to be adapted to the nature of what you do, and then you're linking that to the different law and legislation. Think about the training, how the concerns are reported, keeping accurate records. So that's, again, quite a lot that goes into that questions. You can think also about different audit systems and the compliance there as well. Risk management, which we're going to cover within the next criteria a little bit more detail. Incident and safeguarding reporting, training, supervision and audits, record keeping and quality assurance. So quality assurance, you can link it to the audit. So all the checks that you do that help you to monitor the quality of the care that is being delivered. So again, specific examples. Maybe you've done the audit, you've discovered something is not working. What have you done about that? Maybe you've done a spot check that helps you to identify something, the gaps. Or sometimes maybe it's about identifying best practice and sharing it across, or maybe sharing it with a different service, like a sister service if you work for a bigger organization. That's the K2. K3 is specifically about risk management and outcome-based practice. So here highlighting those two terms that you need to be familiar with. So here you need to be familiar with the principles of risk management, assessment and outcome-based practice. So for PAS, you have to explain how you use and prioritize statutory standards, codes of practice which underpin practice in relation to management and risk management and outcome-based practice. And again, for the distinction, you have to evaluate. So in terms of the risk management, so think about everything that you've got in place that goes towards that risk management. So of course, for you, your risk assessment. So actually, I'm going to jump to this slide and then come back to this one. So you've got the risk assessment. You're going to have your model that you have applied with the guidance from the owners of the organization that you've applied, but the kind of the standard model even promoted by the health and safety executive, those are those 5 steps. So your risk management starts with identifying the hazards, what that means to you in terms of your organization. Every activity that happens within the premises or as part of kind of you being there doing your job is going to be linked to the different hazards. So your job is to identify those hazards, then think about who might be harmed and how. Then you're evaluating the risks and implement control measures. So again, is that likely to happen? What can we do to control it, which means reduce that risk? So sometimes, well, you technically cannot remove the risk because that would mean removing that whole activity or a person, but you can put things in place to manage that, and that will help you to mitigate that risk as well. Then you record your findings and then implement them. So it's about sharing it with your staff, and then you regularly review that. So you're going to have within your organization regular kind of review schedule for your risk assessment. In addition to that, you would review it when something happens that actually that risk assessment cover that area. So if we've got an accident, let's say it was a fall risk assessment and somebody had a fall, then you would review that specific risk assessment for that individual on that. So again, if you would have here a specific example, that would be a good one to share with the assessor during your exam. Actually, I can go back to the previous slide, but I'm just going to talk you through it. So in terms of that risk management, what else you need to think about? Another term to cover is positive risk taking. So positive risk taking is about, your approach to management of risks. So you don't want to create a risk-averse culture, because risk-averse culture could mean that people are withdrawing. There's a negative impact on their well-being because they don't feel like they've got control over. You take away from people the right to make risky decisions or right to take risks. So the positive risk taking is that person-centered approach to risk management, where you promote risk taking to that individual, because there's a learning in that. There's giving them power, giving them control over what's happening. But that's why you've got your risk assessments in place, to make sure that risk that the person's going to be taking is done in a safe way, or the safest possible way. So let's say if you've got an individual who's at risk of fall, you're not going to keep them in bed just because there's a risk of they're going to fall. So I'm going to keep them in bed all day. That's not going to work, because actually you're taking away from them the mobility. Is going to decline, so the physical and mental health as well, that motivation to live and kind of be part of the wider community as well, gonna go with that. So to promote positive risk taking, you would identify what can I do to promote that mobility. So maybe I'm going to ask the staff member to always be there. Maybe I'm going to introduce a specific equipment. So this is kind of that positive risk taking, is kind of outweighing the risk with the benefits to that individual. So that's very, very important. So that risk management. So think about risk management, those 5 steps, person-centered approach of that, in risk managing, involving individual in that process, and positive risk taking. So those are the main things you need to mention here. And that outcome-based practice. So before I link it to the risk management, so outcome-based practice. So again, note that term because you need to know what it means. So if you think about the outcomes, so outcomes is the difference you make to that individual life with the work that you do for them. So think about, this is kind of almost like explanation of why you are there. So justification of your presence there. What was the reason why you are there with that individual? And then that outcomes that difference that you make to their life. So what they want to achieve. So again, that needs to be written into person-centered care plans or support plans, because this is, what you're working towards, what you're helping that individual to achieve. So again, with the risk management, how you help those individuals to take risks and what they want to achieve. So this is your outcome-based practice. If you remember from when you were completing some of the assessments, you also looked at the strength-based approach and person-centered practice as well, and you were comparing those 3. So might be good to bring that into the conversation here and think about, how you set the outcomes for the individual. So you might be doing it using the SMART principles, for example, and how you monitor that. So that's your monthly reviews. Now we're going to move on to K4. This is change management theories and tools. So this is actually a very important criteria. One of those that if you're going to get stuck on it, that may mean fail on your exam. So I would suggest you focus on this criteria and prepare yourself to answer those questions. I might just do a separate video on that just to go a little bit more in depth. So here you have to talk about the principles and underpinning theories of change management. So this is our key word here, change management, and we got approaches, tools, and techniques that support change process. So if you're going to describe the change management theories, processes, and tools used, that's going to give you path. But you want to go into the distinctions, so you're going to evaluate. So what I'm going to tell you here, prepare at least two, I would go for 3 if I were you, change management theories. So know who was the researcher for that theory, what it was about, and have an example how you used it. So each theory kind of breaks down in different stages, so kind of there's like a model assigned to it. So when you're going to be describing that theory with an example, for each of that stage, you can say what you have done for that practical element of introduction of change, and then what worked with it and what hasn't worked with it for you. What would you do different? And that's actually going to give you distinction. And I'm sure a lot of you are introducing digital record systems. There's lots of changes happening in care. So select an example of when you've introduced a change. Maybe change it to the rota, could be something small, but how you went about that. But start, with the model, what the preparation. So you have to talk quite a lot on that. But like I said, I'm going to do another maybe video just to support you with that one, just on the change management. Tools, so think about tools and techniques. So tools, I would put maybe SWOT analysis, maybe force field analysis, that you could talk about that, and then you can link it to the current lowing models as well, and the techniques about how you've done that. So this is quite again a lot that you need to cover within that. But it is a key question. There's few of them that you must know for your exam. So here you've got a bit of an overview of what to include in that in your answer, basically. So got successful change relies on strong leadership, communication, staff engagement, and continuous review. So again, it's about identifying what change we want to introduce, what are our driving forces, what is our resistance, how we're going to communicate it to staff, highlighting successes as we introduce the change. So what you need to cover here: clear vision and communication, person-centered change, staff involvement, so how you do that, continuous evaluation. And then here you've got some examples of those models. Not saying you to use those. You have to choose the ones that are easy for you to remember, easy for you to talk about, and that you're going to have an example to support. This part you can relate to it as a tools that you have used to introduce change. With the risk assessments, more of like the risk analysis for your change or for the projects you were working on. But again, I'll do another video just to talk about that. Choosing the right model. So again, depending on what change you're gonna introduce, you have to kind of talk a little bit more in depth about that. So that's the change management. Now K5, legislative and regulatory frameworks for quality. So again, if you have covered those first two criteria well, you probably have covered most of this one as well. So here you have to explain how you use and prioritize statutory standards, guidance, and codes of practice which underpin practice in relation to quality standards. So again, let's have a look at what you can cover here. So you can see we're going back to what we have covered here, and here we've got a link to the CQC Single Assessment Framework. So you've got, sorry, that's not very good formatting here. Safe, effective, caring, responsive, and well. Those are quality statements. So how do you make sure you meet them? So again, you can talk about quality assurance, you can talk about different legislation that's embedded in. Remember, your single assessment framework is following the Health and Social Care Act 2008. So that's what you need to kind of talk about here and how you deliver. But like I said, you may have already covered that one if you gave detailed answer to K1 and K2. It's again depending how the assets are asked. It might not be in this order. Performance appraisal and disciplinary theory, K6, another very important criteria. And when I see the learners failing on the endpoint assessment, it's very often this criteria comes back as a feedback that there was some gaps in knowledge. So here we've got theories and models that underpin performance and appraisal, including disciplinary procedures. So I feel like sometimes this is not covered enough on your qualification. So again, depends on your tutor and the knowledge of the processes and EPA. So sometimes we just touch on that rather than going in there, but this is a very important criteria. So here again, you need to know theories and models that underpin performance and appraisal included. So you probably know how to performance manage your staff, disciplinary procedure of your organization. Think also about performance management of those who are performing well and want to progress. So again, how do you work with them? So here again, for the distinction, we have to evaluate those theories. So again, have a theory and how you use it in practice. So here what I would look towards, it's more towards the motivational theory. So you've got some of them here. Again, choose the ones that you're going to feel confident talking about. I always hear mention Maslow hierarchy of needs because probably that's the one that you are familiar with, and it's quite easy then to translate it into your kind of work practice. So what Maslow hierarchy of needs means for staff management, or the performance management. So it's looking at the needs. So from the work perspective, the work needs to satisfy some needs of the staff. So when we go to work, so if you think about yourself, you want to have a safe place of work, you want to be listened to, you want to be valued. So those are the kind of those that need to be met. So when the staff are underperforming, it's for you to identify, because you always need to show that supportive nature of that performance management process. So we're not going straight in and telling them off because they haven't done something. Again, if it's a gross misconduct, that's a different story. But with this one, you more focus on why is my staff not performing? Where is that need lacking? What is not being met? So the first stage of the performance management, that review process, will be to meet and identify what's not working, explaining to staff, the standard to which they need to be working, and offering them support. So it could be in the form of training, some coaching, mentoring, whatever it's needed, maybe some route adaptation. I know, like I had a staff in the past that would be always late. So from the perspective, of that supportive element of the performance review, we suggested, okay, maybe we need to ring you. So that for me it was maybe going over the board, but actually maybe that's what that staff needed for a short period of time, just to make sure he wouldn't be late on a shift. So that's kind of what you need to identify. Then if you don't just leave it, you meet with the staff, you review, you make sure that they are working towards improvement. If that doesn't happen and you've put everything in place, then you move to the disciplinary process, because you have to recognize, is it staff that won't do it, which is your disciplinary straight away, or they can't do it, which is capability. So there might be something lacking, and we can with support almost like fix that. We can help the staff to improve. So that's what you're going to be looking at the performance management. You can also, performance management cycle, so that's with the performance review, you can put it in there: plan, monitor, review, develop, improve. You could talk about appraisal systems here as well, because again, for the staff that are wanting to develop further, you would be setting the SMART objectives. SMART objectives, you're going to be using them with the performance reviews, with the supervisions, with the one-to-ones. You always set them some actions. Feedback and observations as well. So feedback needs to be given as soon as possible, so the staff knows it is kind of relevant. If you're going to give it like 3 months down the line, this isn't going to work, because they probably forgot what was there and what happened and what they haven't done. So observations, you probably do that through different spot checks that you use. So again, select some models that you use, have some examples of how you've done it, what went well, what didn't work. Again, I might just create another video just on that topic, because I feel it's quite important for generally your qualification for your role as well. So just to summarize what you need to know, we've mentioned here, didn't mention earlier, the Health and Social Care Act 2012. I think from this one, what you need to remember, maybe partnership working, or just read a little bit more about that. Those two are the most important one for you, that you must know. If you're going to forget this one, I would say probably not a big deal, because if you're going to start talking about those, you're probably going to have a lot to say. And anyway, you could bring in also the Health and Social Care 2022, because that has changed quite a lot in terms of partnership working, because it's looking at that multi-agency working and the integrated care systems, but also your trainings has changed, because now you have to make sure that your staff are trained on autism and learning disability training. So that's no longer nice to have. It's been actually 4 years, so it's a mandatory one. A Care Quality Commission Registration Regulation 2009. Again, if you're not going to remember that one, it's not a big deal. Remember the codes of practice that I've mentioned earlier, so CQC Fundamental Standards, Care Certificate, 6 Cs, Skills for Care Code of Conduct. So that's important. Here I've got at the end, towards the end, some leadership models, because again, when you talk about the performance management, you can bring in those, I would say specifically those two leadership models. So transactional leadership, I think it's more about that reward and punishment. So if you think about the disciplinary, or maybe more of performance management. So if you set the boundaries for staff, if you're gonna do this, this is your reward. If you're not gonna do that, this is your punishment, almost, like kind of just to simplify. Transformational leadership is more about that supportive element, developing your staff, coaching, mentoring, and helping them to change and improve as well. So those are some of those leadership models. We're gonna come back to them on a different EPA session or recording. Change management, again, just highlighting some other models that you maybe want to you want to prepare for your endpoint assessment exam. Remember, you can have your notes, don't make them too detailed, just the key points. So like, again, if you choose the model, I will probably break it down into those different stages, or maybe practice in front of a mirror, or just record yourself and listen back to your answers, practicing those, how you present the examples. So what you should know for that area in terms of different terms: so outcome-based practice, risk management, risk assessment process, positive risk taking, CQC Single Assessment Framework. Well, you should know that, probably know that anyway. This is going to be more important for your observation, which I'm going to do another video on. So that's, again, change management. What is the change management? What tools, the techniques you have used? Think about the SWOT analysis here. I'm not sure if I've mentioned that one. Performance management. So again, those models and theories there that you need to know. So that's all. Hopefully you found it helpful.